Hi everyone, this is Ben. I'm a physiotherapist from New Life Physio and Health Clinic. Today I'm joined by Afsoon, certified orthotics from Orthomec Clinic. Today we're gonna go over most common use braces of the knee, and we go over the most common situations that we can use any of these braces, and Afsoon is gonna give you a few more details about the usage and what type of conditions should be more useful for any of these braces. Let's start with the movement limiting braces. Actually, sometimes when you were undergone any type of surgery, any type of ligament repair, or if you had an injury and your surgeon preferred to manage the ligament repair non-operatively, you might need to limit the range of motion of the knee for a specific amount of time. It very depends on the rehabilitation protocol. That's when it comes to these type of braces, right?
Right, exactly. So for example, this knee brace has articulated, hinge articulated, and you can adjust the range of motion. For example, in bending, we can adjust it from 0 to 30 by pushing this pin and move it upward, so we can lock this like 30 degrees of range of motion. In addition, you can lock and unlock this knee brace. For example, if you push it down, you can lock it in extension if the patient needs to be, the knee needs to be locked, or push it up to unlock the knee brace.
I just had a client who undergone a surgery for repairing the ACL and MCL, and according to the protocol, he needs to be on this braces for 4 weeks to limit the range of motion. So based on the type of the surgery and the goal of the patient, that degrees and timeline would be different, but definitely some limitations, especially after the surgery or the ligament injury, is definitely preferred. In some specific cases, they prefer to manage the ligament injury without doing any operation. So basically, if you have any injuries of ACL, PCL, MCL, these are the three common ligaments of the knee that could be injured. They prefer to just limit some articular movements of the knee joints and kind of putting some stress off of the ligaments and let it to heal in a specific time. For example, sometimes we prefer to limit this movement, sometimes we prefer to limit this movements. It depends on the ligaments that injured. Do we have any option really for these cases?
So actually, this one is a common knee brace. We have knee braces for actually ACL, PCL injuries. For example, for ACL, we need to have this strap, which sits in front of the leg under the knee, and then this strap needs to be really tight. For the PCL, this strap sits above the knee in front of the thigh, and this one needs to be tight really if the injury is about PCL. Also, this is really good for the MCL and LCL ligaments, which are around on both sides of the knee. So because the knee brace has 2 hinges on the side, it's gonna support those ligaments. Just keep in your mind that these needs to be custom made, and usually off-the-shelf one does not fit well, and sometimes does not help the patients enough.
Okay, so based on the application and the size of the tire probably from the clients, it should be definitely custom made.
Even sometimes we do casting and do the shaping of the leg in order to make those.
Okay, interesting. Let's talk about the functional braces. Basically, at the end of the recovery, that we just need a little bit of support, and some of the patients feel just more comfortable to have a braces on when they are returning to sport or daily activities, and that's when they might need some type of functional braces. And could you give me a little bit more explanation about different types and how they can get one of these braces?
Of course. So I have one model here.
Okay.
These we call functional braces or off-the-shelf braces because clients can find them like in different places. So, but those comes in different models. Some of them comes with hinge, which this one has hinge in it, but someone there is no hinge and it's just elastic. Also, this model is a sleeve model, so by using these 2 pieces, you can put it on easily, and but you need to have enough hand dexterity.
Strength.
Right, the strength. But in case the patient does not have enough hand strength, then we can use the model, which is open from the front, and we can like put it on like wrap around.
Okay.
Of course, that those are off the shelf, but I recommend patients to see an orthotist in order to get those. Those comes in different size and shapes and models, and we prefer to really first get the history of the patients and give the proper one.
Yeah, of course. Yeah, of course. Thank you. The next type of braces, we're going to talk about the patellar tracking. Sometimes we have a patient with the patellar tracking issues. It could be a dislocation, or it could be any problem with the patellofemoral joint, and we prefer to track the patella and in most cases push it back in. Is there any braces that can help in this situation?
Of course we have. So in these cases we have off-the-shelf knee braces. They are specifically for the patella, to stabilize the patella. So they have buttresses around the patella with two straps. So those buttresses, usually we can adjust the tightness of it with these straps. So, and by tightening, we're going to hold the patella in the middle, and we prevent it from outward tracking. This way, patients can wear it for 2 months, maybe to 4 months, and then during this rehabilitation time, the movement of the patella improve.
Okay, that's good. A common question I get to hear from my clients that is there any type of braces that can help with osteoarthritis? Sometimes because of the degenerative changes on the inner side or outer side of the joint, we have a little bit narrowing of the spaces, and that's the main reason for this inflammation and pain coming from the arthritis. Is there any braces that can kind of widen that spaces and help patients with the pain control?
Yes, we have actually. So I'll explain it a little bit on this first, and then I'll show it on the knee brace. So usually, for example, if we have the medial compartment osteoarthritis, these like blue things that you can see is started to get thinner. So then the bone started to get close this, and then the space is made on the other side. So by the knee brace, we're gonna put a hinge here, and then by strapping, we push this side in order to offload the medial side, and vice versa. And sometimes we have osteoarthritis in 3 compartments: in the medial, in the lateral, and also under this patella. We have a special knee braces that offloaded all 3 compartments, but that specifically needs to be custom made. For osteoarthritis, I really recommend patients to be seen by an orthotist first, get assessed fully, and because and the leg needs to be casted first in order to make a really effective osteoarthritis.
Okay, brace. Yeah, that makes totally sense because patients have different issues with different parts of the knee, and that would be great to be assessed first. And finally, how about the clients that have a weakness of the quad muscle for any reason? It could be a nerve damage, or as you know, it's a common complication after some of the surgeries. But for any reason, they don't have enough strength in their quad muscle, and they're not able to keep the knee extend or straight when they are standing or walking. So is there anything that help and support the knee and kind of helping with the quad muscle to keep the knee straight?
Of course we have. So in these cases, because actually we have a nerve damage, and so then the patient is not able to hold the knee in extension, so we need to lock the knee on inside the knee braces. For example, if I want to explain on this one, for example, on this one, we're going to put a lock mechanism here. So when the patient is standing up, the hinge needs to be locked. and when the patient want to sit down, it can be unlocked. And locking and unlocking has 2-3 different way to do it. Some of them we call them drop lock. So then it's just more stable. We use it more for old people. But sometimes we have another like a younger person, then we call it bay lock. I don't have it with me now, but I can give you some pictures of those knee braces.
Yeah, of course.
You can add it to our conversation.
Yeah, of course. So there is a way that we can kind of lock the knee in extension, at least helping with the walking and moving around.
Of course.
Okay, thank you so much. I think that's it. It was a kind of a general breakdown of different types of knee braces, the most common ones that can be used during the rehabilitation process, usually with the orthopedic issues. And I'm pretty sure there are many other types that hopefully we can have another video on explaining and going over those braces as well. Thank you so much for joining us today.
Thanks for having me.
Oh, you're very welcome. If you guys living in Ottawa or surrounded areas, I will actually leave the contact information of your clinic, the Orthomec clinic, in the description of the video, if that's okay with you.
Yeah, that's fine with
Yeah,
me.
feel free. Oh, you're very welcome. Feel free to join her if you need to make, fit, or even having a consultation regarding the knee braces. But just a quick overview that bracing is part of the rehabilitation, is a tool, not a cure, and definitely the other part, doing exercises and having the other parts of physio, you can have the full recovery from any type of musculoskeletal injuries. Thank you so much.